Hello everybody, and today in this video we will be talking about CT colonography and its pros and cons and multiple others. Screening for colorectal cancer is very important and should be conducted between the ages of 40 to 60 years old. One of the decisions for colorectal cancer screening is CT colonography, which is a propelled sort of figure tomography yield of the colon and rectum. For this test, the patient is examined twice in the inclined and prostrate positions. This test uses gravity to help inflation of colonic fragments. It's additionally one of the choices with pretty much no complications at all. A CT sweep uses xrays to discover harmful development such as polyps and premetastatic growth. Anyways, rather than taking one picture like a typical X-ray, a CT colonography scanner takes various photographs as it pivots you while you lie on a table. A PC then joins these photographs into essential photos of the bit of your body being analyzed. For the results, computers make 2-dimensional X-bar pictures and 3-dimensional point of view inside the colon and rectum, which allows the doctor to scan for polyps or growth. This test is useful for people who can't or don't want to have an hazardous test. For instance, a colonoscopy. This test should be able to be acceptably quick, and sedation isn't fundamental at all. Like any test, this test also has pros and cons. The pros of CT colonography is that it's lively and safe. It can generally view the entire colon, and it is done predictably. Also, there is no sedation required. The cons are that it can miss little polyps and full bowel prep is required, and it also has false positive test results, and you will be exposed to a constrained amount of radiation. And obviously, it can't expel polyps during testing, and a colonoscopy will be required if any abnormalities are found, and medical coverage may not cover this either. The main purpose of colorectal cancer screening is to locate any metastatic or premetastatic polyps or tumors in the bigger digestive tract, because if colorectal cancer happens and the symptoms start, it's probably too late, and even the best hospitals in the world can't solve this issue. During CT colonography, the doctor will insert an exceptionally little flexible tube that has a length of 2 inches up your rectum. So the doctor guy will pass air into your rectum utilizing a handheld press bulb. Once in a while, the doctor person uses an electric pump to convey carbon dioxide into the colon. Also, the doctor can insert a little inflatable balloon to keep the air tube stable. The purpose behind inserting air into the rectum/colon is to inflate the colon/rectum as much as the doctor guy can, so the specialist can see the whole environment. Next, the conveyor belt table the patients are on will go under the scanner. Patients are normally told to hold their breath for around 15 seconds before turning over and lying on their back for a subsequent sweep. CT colonography is normally finished in 15 minutes or so. And like we talked about earlier, it has advantages and disadvantages. Another one of the advantages are that it is minimally intrusive and gives both 2D and 3D pictures that can recognize polyps and different injuries. Also, CT colonography has a less possibility of puncturing an opening in the rectum than colonoscopy. This test is really good for patients who have clinical variables that up the stakes for colonoscopy. Old patients who are powerless and fragile, obviously, will probably endure CT colonography of more than they can endure colonoscopy. CT colonography can be helpful when a colonoscope can't go through due to the tumor or other development in the rectum/colon. It additionally gives more clear and more point-by-point pictures than a barium enema test. It can also recognize things that are not ordinary outside of the colon. For example, sensing malignant growth in the pancreas or the liver. Another good factor is that it's tolerated by more or less all the patients. Also, there is no requirement for sedation, and no painkillers are required after. If a test, and like we talked about before, it also has cons. Another one of the cons is that there's extremely little danger of perforation of the colon rectum, and it occurs in just 1 in 10,000 patients, so there is literally no mortality risk. Although there is a slight possibility of cancer because of radiation. However, the advantage of a precise conclusion far exceeds the hazard. Another con is that it isn't suggested for pregnant women because of the fact that radiation can disrupt the unborn child's growth. Also, another con is that the radiation can vary. What's more, if a patient is obese, he or she won't fit inside the scanner. Also, CT colonography is just to alarm what's happening inside. In the event that a polyp is discovered, colonoscopy will be required. It will also not separate little bits of stool from antiques and smaller polyps. It's additionally not suggested for individuals who have active Crohn's disease, ulcerative colitis, and sedentary inside, infection, and diverticulosis as a result of an expanded possibility of aperture of the colon/rectum. Most insurance agencies don't cover this technique. However, they may if symptoms are found. Also, if the doctor finds everything normal, you're at average hazard for colorectal cancer, and you have no hazard factors except age. Also, the doctor recommends this test should be done at regular intervals if everything is discovered normal. On the other hand, if this test uncovers any polyps or any growth that should not be there, the doctor will recommend you to have a colonoscopy, which has its very own complications. Now and then, the colonoscopy should be possible the same day that the test was conducted, so the evacuation of any abnormalities or polyps can be done almost immediately. Like I said before, if any abnormalities are found in some other organs, the specialist may instruct you to get different tests conducted. For patients who are at high risk for neoplasia, who have been under colitis surveillance, a mutual approach among radiology and gastroenterology will help guarantee these patients are research complete. Personally, I don't like the idea of CT colonography because it requires full bowel prep and it cannot expel any polyps or any adenomatous growth. During a colonoscopy, a colonoscopy can expel polyps and adenomatous growth and take biopsies also. And for both tests, a lot of money is needed and full bowel prep is needed for both. So I think that a colonoscopy should be done instead of a CT colonography for numerous reasons, such as the hassle for a bowel prep, the price, etc.